Hey everybody, Tim Albrecht here, and thank you for listening to the YFP podcast, where each week we strive to inspire and encourage you on your path towards achieving financial freedom. This week I had the pleasure of talking with Dr. Victoria Reinhartz, CEO of Mobile Health Consultants, a business founded to solve the access to care problem by empowering interprofessional mobile integrated health and community paramedicine teams. During the show, we discussed the why behind building mobile health consultants, the target audience and offering and how this has evolved over time, how Victoria was able to get over the initial hurdles of starting a business, and how she balances her time running a growing business while also working part-time in an academic position. Now, before we jump into the show, I recognize that many listeners may not be aware of what the team at YFP Planning does in working one-on-one with more than 280 households in 40 plus states. YFP Planning offers fee-only, high-touch financial planning that is customized to the pharmacy professional. If you're interested in learning more about working one-on-one with a certified financial planner, may help you achieve your financial goals, you can book a free discovery call at yfpplanning.com. Whether or not YFP Planning's financial planning services are a good fit for you, know that we appreciate your support of this podcast and our mission to help pharmacists achieve financial freedom. Okay, let's jump into my interview with Dr. Victoria Reinhartz. Victoria, welcome to the show.
Oh, thanks for having me, Tim. This has been a long time coming, so I'm glad we're able to put it together.
It has. We crossed paths this past year through the pharmacy entrepreneur circles. And after I learned a little bit more about your career path and the work that you're doing with mobile health consultants, I knew we had to bring you on the show to share a little bit about your entrepreneurial journey. What was the genesis of the idea? What is the work that you're doing? And we know that we have many pharmacists in our community that are itching with an idea or a side hustle or business that they're working on, and excited to feature other pharmacy entrepreneurs such as yourself. So let's start with your background in pharmacy. What drew you into the profession? Where did you go to school? And what was the first position that you had after graduation?
I decided to become a pharmacist because I am kind of a nerd at heart. I really enjoy a good puzzle, so to speak. I think that every patient and the best drug therapy for them is really a puzzle for us to figure out and navigate through the various challenges related to genomics and treatment course and side effects, et cetera. So the nerd at heart in me, I love putting together puzzles, and I ended up going to pharmacy school at LeComm School of Pharmacy and graduated I guess now over 10 years ago, which feels crazy, right? We no longer qualify as new practitioners.
We don't.
But that's all right. So graduated from LeComm School of Pharmacy down in Bradenton, Florida area, and stayed in Florida to practice more in the community setting. But I, was fortunate enough to continue to take on leadership roles and new opportunities to develop skills within myself, which really is what led to a lot of the opportunities in academia and public health and now mobile integrated health that I'm involved in.
So one of the things, Victoria, I read that you shared on LinkedIn was a story from your last year of pharmacy school when you did an educational training session, I would assume during an experiential rotation for a nursing staff at a hospital. And through that experience, you realized the love that you had for teaching and problem solving. Tell us more about that experience and how did it influence some of the career path and directions that you've taken today?
Yeah. So the story that I have on LinkedIn is a true one, and it is something that I feel still happens to this day. So I come from a super blue collar family. We cuss a little bit in our family. I don't know if any pharmacists listening, if you have families that cuss a little bit. My family is super blue collar, and I had been practicing saying like how to say glomerulus, and I was so nervous about this presentation that I was going to do to an inpatient nursing staff. And after the presentation, a preceptor pulled me aside and wanted to have a serious talk with me, and she was kind of had that serious face on, and I said, my goodness, I've cursed in the middle of the presentation, right? I let a 4-letter word slip somewhere on accident, but she wanted to have a serious talk with me about my future and about whether I had considered teaching. And like many of the entrepreneurs that you bring on the podcast here, I thought that when I decided not to do a residency, that I had closed the door on any opportunity to teach. And, I was candid about that no, I decided not to do a residency, so I don't think I would be allowed to teach anywhere. And she really encouraged me to, pursue opportunities where I got to develop that skill set of teaching.
Mm-hmm.
And so when I graduated and took a role in community pharmacy, I started figuring out, how do I gain teaching skills? So I started to bring in new pharmacists to train them. I started doing teaching events with our local pharmacy school and in local college of medicine. I started, taking on more initiative on the district level to figure out, how can I develop the skill set that I need to become, a
Mm-hmm.
faculty or a professor. And so really that professor had a huge impact on my life, that preceptor. And it was secondary to her taking a minute and saying, I think that you should develop this,
Mm-hmm.
that prompted a lot of the steps that I took to continue to develop myself. And so, once I had kind of launched some of those things where I felt more comfortable in teaching, I had been engaging in teaching concepts for a while now. I took the opportunity to apply for a faculty position. I did accept that faculty role in 2015 with LECOM, but I
Mm-hmm.
knew that I wanted to really stay involved in clinical practice as a younger practitioner. And so I started working in the public health department and doing tuberculosis management and women's health and immunizations and things like that. And, I was brought in to kind of help the Department of Health figure out a solution for our access to care problem.
Mm-hmm.
We started brainstorming, and really, this is where I found the passion for what we call community paramedicine and mobile integrated healthcare. And like a lot of pharmacists, I think, when we start to do a side hustle or when we step out to become an entrepreneur, it's often born out of a problem that we've identified in
Yep.
practice that we feel passionate about, or, something that is just like lights our soul on fire, right? Like
Mm-hmm.
something that
Mm-hmm.
brings out that I want to do this, I'm excited to do this. I this lights me up, and it keeps me up at night. And so this was kind of a blend of those things. There was a big problem, as we know, in all of our communities. We have a huge number of patients or underserved populations that are not able to navigate the
Mm-hmm.
healthcare system, right?
Mm-hmm.
So they don't have primary care, they're uninsured or underinsured. They don't speak English and can't navigate, even getting established with a primary care. And so what this leads to is we have these patients utilizing the 911 call system and
Yep.
emergency rooms as their primary care, right?
Yep.
So, definitely something that we all see in our communities. We know that health outcomes suffer. We know that cost it gets expensive. And so I said, well, why don't we do a pilot? Like, why don't we launch a pharmacist and a paramedic side by side into patient homes on a proactive basis? So,
Mm-hmm.
not when the 911 call comes,
Mm-hmm.
but, paramedics know who in their community needs the support.
That's right.
They know who's calling 911 all the time. They know when, Mr. Jones calls for the fourth time that they're going to be back next week.
Mm-hmm.
And so they know who to see. And so we launched a pilot with a pharmacist and a paramedic side by side together, going into the homes proactively for these patients that did not have the resources they needed. And we were able to see a huge impact in reducing the overall cost of care, but also improving the health outcomes. And so that is now how my entire consulting business is founded in, the mission of empowering these paramedicine teams with the training and resources they need to improve access to care.
I love that. And I want to come back and dig into more of what you're working on with the consulting business and how it's grown over time, the vision you have it for it going forward. I want to make sure we don't gloss over, though, some really important parts of the story you shared, on that rotation and that experience. And one being great mentorship, right? All of us have the opportunity to interact with other pharmacy professionals, perhaps we precept students as well. And we never know the impact that some of those words of encouragement or just seeing a skill set or a passion in someone and either affirming them in that skill set, encouraging them in that as well, the impact that that may have long term. So it's just such a great example of that. And then another key piece that I really heard in that story was initiative, right? So one of the mindsets that can be out there is, hey, I can't get X, Y, or Z job. In the case here, you were talking about a faculty position teaching because I might not have insert whatever residency training, board certification, whatever credential. That's one mindset. The other mindset is like, I'm going to figure it out. I'm going to figure it out because I have a passion for teaching. I have an interest in it. Somebody else has affirmed that skill. And I'm going to kind of blaze that pathway, and I'm going to take initiative in building relationships, collaborations, and getting opportunities that I can then go and make a case for why I can provide value in this teaching role. And what's really interesting, Victoria, is you are doing teaching in somewhat of a traditional format, obviously in a faculty type of role or position, but you're also teaching every day in the work that you're doing through your business. And I think one of the things we got to be careful about is, if we have a gift or a passion in a certain area, but we feel like we may not be able to do that because it's defined a certain way by an employer or in a certain career path, it doesn't mean we can't do that, right? You can teach, I can teach. I'm not in a formal academic role anymore, but I'm teaching every day on personal finance. It's a different method of delivering that information, but it doesn't necessarily have to be defined in the way that we may think that it has to be with a certain step or credential or degree or pathway to be able to do that. So I love that story and that journey. I think that's so powerful. So when it comes to mobile health consultants, so you talked a little bit about the pilot project, the initiative, the problem and the opportunity that you saw that you were able to solve. Tell us more about the step from idea to actually beginning to implement that business, right? It's one thing to identify, a problem that needs to be solved or an opportunity that can be addressed. And you could have continued to do that through collaborations and partnership with existing entities while you're employed in other positions. But it's another thing to really take a problem and then develop a solution through creating a business. And here we're obviously talking about the consulting work that you're doing. So tell us about that early stages and how you were able to initiate and get started with developing the business.
Well, I have to say that, we do not do a good job in pharmacy of teaching or creating skill sets around entrepreneurship in general, I would say.
Amen.
And I know that you and I have gone back and forth about this issue over the last few years, and so many others that are out there creating side hustles for themselves, creating small businesses and solutions in the healthcare industry and outside of the healthcare industry
Mm-hmm.
also feel that way. But I was in that boat. I felt I knew a little bit from managing a pharmacy or being involved in pharmacy management. But when you talk about entrepreneurship and establishing a small business, that's not enough. It's not even close to enough, right?
Right. Mm-hmm.
And, I did find it difficult in the beginning. I still find it difficult every day because so many pharmacists are kind of inherently intelligent and they're kind of good at things that they do and can figure things out really easily, and some of us, maybe you didn't even have to study that hard for
Mm-hmm.
some of your undergrad courses and things. And I think that was a big challenge for me in the beginning, was
Yeah.
struggling and navigating, how do I do this, what are the laws and regulations, how do I draft contracts, how do I set my hourly rates, all of those pieces have to be figured out. So I had a lot of success with, first of all, finding coaches.
Mm-hmm.
So, for
Mm-hmm.
anybody on this podcast, and Alex and Jackie Boyle and the team from Happy Farm D have not asked me to discuss this or mention it or anything, but I did actually go through the Happy Farm D processes
Oh,
for
fun. Mm-hmm.
prioritizing myself and my own goals and figuring out, what do I need to do to make this happen? It's living in my
Mm-hmm.
heart. But like so many of us that are parents and spouses and professionals, our own personal passions tend to take a back seat to all
Yeah.
the other things that we have to do, right?
Mm-hmm.
So I did pursue some coaching with Happy Farm D to create a series of deliverables for my own goals that I knew would set me on the path to getting established. I also found the Small Business Development Center, or the
Yes.
SBDC,
Yep.
to be really valuable. And I will tell you, I still meet with my SBDC rep, like, I don't know, every other month or every few weeks if I need
Yep.
to, if an issue comes up and I'm like, I have no idea how to handle this, or can you help me find someone in the area that is a trustworthy
Great
source
resource.
in
Yep.
this expertise area. So you have to ask for help.
Mm-hmm.
And for a lot of these things, you have to be willing to kind of put up the money, right?
Mm-hmm.
If that's what it
Mm-hmm.
takes.
Yeah, and I'm glad you mentioned the SBDCs. I've talked with several pharmacy entrepreneurs or those that are building something just in the last couple of weeks, and that was one of the resources I pointed them to. Hey, have you talked to the SBDC in your area? Because it's even the technical stuff. Some of that might be helpful. Some of it maybe you've already kind of gone down that path. Putting together business plans, LLC formations, things like that. But it's about beginning to be a part of that network and community where someone might say, "Hey, have you talked to so and so?" Or "What about this? What about that?" And I think it's just helpful to know you've got someone else in your corner, to bounce ideas and questions off of as you're developing. It's such a great free resource that's offered all across the country. We'll link to that in the show notes so folks can find, SBDC office in their area as well. And then you mentioned the impact of coaching that can be there as well. Let me ask a follow-up though, Victoria. Even with coaching, right? Even with putting up the dollars, there's still a step of getting over the fear, right? The fear of, man, is this going to be successful? What if I mess up a contract? Who am I to kind of put myself out there of this, expert in this area across the country? There's all what I like to call the head trash that might get in the way of us being able to actually move something forward. And coaching can help that. Don't get me wrong. But at the end of the day, like we've got to be able to be comfortable taking some risk to move something forward. So for your journey, was that a thing? Was that a part of the journey? And then how were you able to get past that to be able to take those first early steps of the business?
I think regarding the headspace, I think it's not really a thing where you can say, "Oh, I don't think I'm in the right mindset," or "I'm being too hard on
Yeah.
myself. So I'm going to do this tomorrow and then that fixes the problem." It's
Mm-hmm.
an ongoing, continuous, daily effort because every step of the process is going to be a learning lesson for you. And so, whether you're earning your first dollar or your 100,000th dollar or your millionth dollar, each of those phases of growth create a new element of imposter syndrome,
Yeah.
right? Or a new
Right.
element where you're not sure, am I ready for this level of the game, right? So it's an ongoing thing and I just want everyone to know that and give themselves some grace. And I think that giving myself grace was a huge part of how I continue to be in the right mindset and how, I approached it early on as
Mm-hmm.
well. You're gonna make mistakes. You're going to have to reach out for partners or resources because you don't know how to do something and you
Yes.
have to figure it out. And you just have to be comfortable saying, "I don't know. I need
Yeah.
support," and give yourself the grace to be able to do that. And so I think that was a big one for me, right? We're a
Yeah.
lot of times our own harshest critics.
Mm-hmm.
And so getting comfortable in that. And then I think the other thing that I would say is, financially, it does take some preparation potentially,
Yeah.
depending on how comfortable you are with risk, with financial risk.
Mm-hmm.
I know that my spouse and I had to put together a plan of, what's the dollar amount that we're going to invest in here, and what's the time frame before we are going to count on a salary coming in
Mm-hmm.
for you that we feel comfortable with. So essentially, what's the span of months or even years? Maybe it might be for some people until we say, "Okay, enough is enough. We did
Mm-hmm.
it, and we were not successful, and we need to kind of go back to a real world job, so to speak." So anything that you can do by saving ahead of time, making changes in the budget, putting money
Yeah.
aside to reduce the amount of risk that you have, or increasing your comfort level with the risk that you're taking
Mm-hmm.
is valuable.
I'm so glad you mentioned that, Victoria, because I think there's a lot of, I'll use the word over glorification of this idea of like just jump and figure it out. And there can be value in like, making some mistakes and learning along the way, but there's also some wisdom in having a game plan and having some backup and options, especially when we're talking about the financial aspects of the personal side. And of course, there's a connection there to the business side. And what we want to prevent is that we're not able to pursue our business with the full attention that it needs and deserves because we're worried about the risks on the personal financial side of things. And everyone has a different capacity and tolerance for risk, right? And so, and everyone's personal situation, of course, is very, very different. But doing that work, as you mentioned, to determine, what is the runway that it's going to take. It reminds me of we had Jody Nishida on episode 266. I'll link to that in the show notes. Has started a keto based practice out in Hawaii, doing some really cool things. And she talked about this for her journey of having a substantial amount of savings that she ended up having to lean on early in her journey because of some challenges that happened that maybe she could have predicted, maybe she could not have. But if it weren't for having some of those reserves, it might have crippled, her moving forward with the business, and potentially without that, she might have felt the need to jump back into the work that she was doing previously. So, ton of wisdom there. I think that you're sharing in terms of making sure that we have the financial plan and preparation so we can approach the business, with the confidence that it does deserve. So, mobile health consultants, I'm going to read your mission statement: empowering mobile integrated health and community paramedicine teams in all 50 states with exceptional training and disease management expertise. So, you painted the picture of kind of how it came to be and the problem you're trying to solve. Tell us more about the target clients, the services that you offer today, and then we can also talk about kind of what you're planning into the future.
Yeah. So, I think one of the exciting things about being an entrepreneur is that you get to kind of follow your heart and you get to really live the concept of success occurs when preparation meets opportunity, right?
Mm-hmm.
So, I started out just offering consulting services and some speaking services. And, that would be anything from coming in and doing a program evaluation.
Right.
So, for these programs that are already in existence, coming in and doing a multifaceted evaluation to look for operational efficiencies, clinical
Mm-hmm.
appropriateness of their programs. That ended up expanding to helping teams launch programs. So, if they are recognizing there's a high number of 911 calls secondary to injury in their area,
Mm-hmm.
or frequent falls, then they might want to put together a falls program, but maybe they don't want to navigate all the challenges of, which home safety assessment is best,
Right.
which falls assessment tool is best, how do we deal with the meds that are going to contribute to falls. And so I began going in and helping teams navigate that. How do you figure that out? What's the best practice in the industry? What should you track for, monitoring your effectiveness? And so that kind of expanded to helping launch new programs and establish both clinical and operational efficiencies. And it has kind of expanded from there. So now I work with teams that are getting set up with payers for establishing what metrics to track and how to quantify their effectiveness from a value-based care standpoint and reduce the overall cost of care for patients that might be Medicare or Medicaid patients.
Mm-hmm.
We also do consulting for technology companies and healthcare service provider companies. So, as they are expanding markets that intersect with mobilized healthcare professionals, which we saw a huge boom of that, right, via telehealth
Yeah.
and community based care programs as part of the pandemic,
Mm-hmm.
as technologies grow to recognize the value of mobilizing teams into the communities, there is a huge need to modify their technology systems. And so we also have an end user design type consulting service that we provide where we give insight to these teams and the companies that are developing the necessary technology.
I love it. And we'll link to the website in the show notes so folks can get a feel for services and offering and educational programs. I think you've done a great job of laying that out on the website. One of my questions for you, Victoria, is I hear you talking about the evolution of the services is that, and I think any early entrepreneur kind of goes through this phase of coming up with the content and the product, doing a little bit of business development and marketing. I'm also obviously kind of the key relationship developer with partners. I'm trying to manage the finances a bit. We're wearing all these hats right at once. And so as I hear what you're doing, and we'll talk about how you balance this with other responsibilities that you have as well, like how would you estimate or break down your time in terms of where you're spending and actually delivering the products and services and where you're in more of the backstage of the business, whether that's in, developing new relationships, partnerships, business development, marketing, brand awareness, promotion? Like how do you distribute your time and how has that evolved over time?
It has evolved. It also waxes and wanes, to be honest with you. So as I pick up new projects with clients, then for a period of time, we'll kind of go intensely more towards one area of the business or another. Some examples of that include the fact that if I have a really intense 4-month project that involves consulting and end user design and technology development and things, then we will, shift, and we might do 60 to 80% on the consulting side as far as, hours commitment for that period.
Mm-hmm.
On the flip side, on the education platform that we do, which is providing mobile integrated healthcare and community paramedicine providers. So this is paramedics, but this can be social workers, this can be nurses, any healthcare profession really. As they are, looking to grow their skill sets, get into this industry, look for future employment
Mm-hmm.
opportunities in this industry, we have a rolling educational side. So for example, we have a community paramedicine accelerator course that launches our next cohort in January. So when January
Awesome.
comes, for a couple of months there, January through March, we'll kind of pick up on the education piece because
Mm-hmm.
multiple times per week, I'll be logging on live and doing caseworking and practice questions and live teachings and active discussions with paramedics across the country. So it does wax and wane depending on the season, which is also fun because it keeps it not boring, right?
That's
But
right.
but in general, I would say about 60% or so of the business is consulting
Okay.
related right now, and then or over the last year or so, and then probably the speaking and education side is about 30% or so, and the remaining 10% is really related to advocacy, involvement at a high level nationally
Okay.
within the industry and internationally. And then also, we do have things that come up that are a little bit unexpected sometimes. So, one of our core values is we get it done plus some. We really believe in
I
going
like
kind
that.
of above and beyond and over delivering whenever that's possible. And so, we've had multiple clients over the last 2 years that have asked for social media, graphic design, newsletter, and content development. And that has been an aspect of the business that I did not originally anticipate,
Mm-hmm.
and that I have actually contracted out and brought in new resources and things to help develop that. And so now that is a growing area that we're going to see over the next few years if we keep it or not. But it's bringing in revenue. And so it's another way that we can over deliver to clients. So that's probably, I guess, things like that are the other 10%.
Yeah. And so you've said we several times now throughout the show. So one of the questions I really like to dig deep on and better understand, because I think it's such an important evolution of the business when you go from solopreneur to having other people that are contributing. And that could be, W2 employees, it could be contractors, it could be fractional services, in terms of kind of piecing a team together. It can look very different, but how have you constructed the team as you talk about we, and what are those different roles where you have some help in the business?
We are in a period of growth, so things are about to change. And Tim, I didn't get the date that this will be released, so it might already be announced. But I'll hold off for now. So we are in the process. When I say we, I do have a few team members that work with me consistently and have
Okay.
now for several months or even years. I also
Hmm.
have interns, so I accept interns
Oh,
each
cool.
year.
That's cool.
And yeah, they stay with me for a period of time. So at a minimum, 3 months, but sometimes that relationship gets continued as they find value in the work
Hmm.
and want to take on additional projects and things. And so, we have interns that cycle every few months or, stay with us for half a year or even longer. So, I think that we from a core team standpoint is pretty heavily administrative. It's pretty heavily education focused and content development focused.
Hmm.
The consulting side and also some of the education, I do a fair amount of contracting out. So I bring in people on a 1099 independent contractor basis who I know will meet the criteria within the industry for projects that I am
Okay.
pitching for. And so if I pitch for a project on social determinants, or if I pitch for a project on high risk medications or pediatric focus meds or whatever that looks like, then I reach out to the network of experts in that area.
Mm-hmm.
That's another one of our core values, is cultivating a network of experts. And so now we kind of have this diverse team of experts.
Cool.
So I think that we now are over we're now over 50 different consultants that we've brought
Okay.
in the last few years in different focus areas based on, what we're working on at the time. And their projects range anywhere from, 3 to 6 weeks to a year or
Mm-hmm.
more.
Yeah, the reason I asked that question, Victoria, and I love the kind of the angle you took, is I read an article recently, and I'll link to it in the show notes, from Y Combinator on the different and evolving roles of a CEO as you're growing your business. And they make a case that a CEO's first job is to build a product that users love, and their second job is to build a company to maximize the opportunity that the product has surfaced. And I think that requires a very different skill set, over time. And one of the things that we're going through in the evolution of just YFP is, early on, my role, is typically is the case for many early entrepreneurs, was all about product creation, content creation. You're wearing all these different hats. And now that we've grown a team over time, it's really about leadership and vision, and that evolving role, in terms of leading the company. And so as time goes on, if I'm building the thing the right way, if you're building the thing the right way, as I know you are, like, your role as a content creator, ideally becomes less important as you build the team and you're able to kind of step into other needs and roles and responsibilities that the business has. So it's fun to see the evolution of some of these pharmacy entrepreneurs over time. Really cool stuff. Natural question as a follow up to all of this is, Victoria, how in the world do you balance all of this, right? So you still are working in the academic setting in a part time role. You've described a very I think impressive and nuanced consulting business that you've built, that has multiple different arms and is clearly on a growth path and trajectory. How do you balance the time, the schedule, the responsibilities, personal and professional? What are some of the strategies that have worked for you?
I'm smiling and I'm laughing because I think most of us feel like, am I balancing it right?
That's
Really? I
right.
don't know.
Yeah.
I think that I am. And I would say that, this ties into what the next 5 to 10 years looks like pretty heavily. I would say that right now I am very dependent on my calendar, and I'm very
Mm-hmm.
dependent on all the intersections of my world being on the same calendar, right? So
Mm-hmm.
my spouse can see when I'm blocked off as busy and out of town or traveling from the work side. My academic teaching schedule has to be integrated on the business
Yes.
aspect so that we know not to schedule there. So, I mean, there's the technology piece that I think helps immensely in just when you're free, and when you're not,
Mm-hmm.
it doesn't work, right? So, staying up to date and utilizing tools to make sure that you're not getting double booked, that you are making time for everything appropriately is important. I
Mm-hmm.
would also say that, if you're in an early phase of content creation, of project based work, whatever that looks like for the type of business that you're starting, you have to be intentional with scheduling, or your calendar will get filled for you.
That's right. Yeah.
So, there's times where you have to dedicate a full day a week to start, maybe more, maybe less, to something like content creation or writing or
Mm-hmm.
social media blocking and those sorts of things. There's also time required for the follow up of that, right? So,
Mm-hmm.
like if
Mm-hmm.
I record my YouTube channel, right, my
Which are
education.
great, by the way, which
uh,
are awesome. I love
Thank
them.
you. The
Yes.
Reinhartz rundown is the title of that.
Awesome.
We'll put it in the notes,
Yep.
or I can send you a link. So, if we record that, it's so multi-phase, right? You need to decide what you're writing
Yeah.
on. You need to narrow it down to the big points people need to know. You actually need to write it out. You need to do the digital transformation to teleprompter. You need to schedule like a day on your calendar to do the
Mm-hmm.
videography. You need to figure out what needs to be done from the editing and block that time. then you need to figure out all of the social media aspects, right, that go along with that. Like, do I do hashtags? How do I caption this? Do I upload to YouTube? Like, what is the drip process? All of those things, right? So it's not enough to say, well, I'm going to do content creation on this day. It's like, I need to map out a process start to finish, and I need to make sure that we have proactively allocated the time accordingly on a schedule so that that gets done without being a point of stress for me.
Yep.
So, I think that it comes with some intentionality, and it comes from recognizing that everything takes longer and is a bigger deal than it seems like it's going to be, and making sure that you're as proactive as possible. The next thing I would say is, I have gotten better about delegating and automating things where I can. So, now, for example, if I bring in someone, an expert to teach in the MIH Academy, before I would be like, here's the thing you need to sign, and here's your contract, and I'm going to get you set up for getting your check, and where does that need to go, and give me your headshot, and what are your objectives, and I'm going to add you into the platform, and all of these aspects, right? But
20
now,
emails later.
yes, 20 emails. So now I outline the process start to finish. I train my assistant on how to do that. And now I just get to do the fun part, right? Where I say, Tim, I'd love to have you do a lecture on this topic, or financial literacy for paramedics, which, by the way, that sounds like a great idea. I'd love to do that.
Sounds awesome.
And so I'm going to connect you to Rain, and then I CC my assistant and I say, introducing so-and-so here, please get him set up for teaching in the academy. And then that process gets executed, even though I'm not the one physically doing it.
And process is the key word there, right? You gave a great example with that most recent one. You also gave a good example with the Reinhartz, rundown YouTube and all the steps. Often it's normal. You're going to be doing all those steps to begin with, right? Until you kind of get to a point where it makes sense that you can justify having somebody help out. But if you can document the systems and the steps in the process, over time, that's the point where you can begin to systematize parts of your business and have other people step in and do it as good, if not better than you're doing it, right? And more consistently over time, so that you can focus on other parts of the business. And that's something that Tim Baker and my partner are always talking about, is how do we build this in a way that doesn't depend on he or I sitting in any single seat of this business. And the reason that's so important, and it's the same for your business, is that, the work you're doing at Mobile Health Consultants and the vision of the problem you're trying to solve is bigger than Victoria, right? You started this, but there's a day where we want the impact and the vision of this to live on, whether you're doing this or you're not doing this. And so if we have systems and processes that are in place that we can bring on team members and others to help execute that vision, all of a sudden we're building something that can transcend, our time and the work that we have in that specific role. So love what you had to share there related to some of the systems and the process. This has been a ton of fun. I have really enjoyed following your journey from afar, at least on LinkedIn, and obviously have the opportunity to talk here. And I know this is going to be an inspiration to many other pharmacists that are perhaps at the beginning stages of an idea or looking to get something started on their own. So if folks already are not aware of you and the work that you're doing, where is the best place that they can go to learn more about you and to follow your work?
So a couple different places. So obviously, on social media, find me on LinkedIn, connect with me, send me a hello message. I'd love to, watch your success and your growth, and serve as a source of contact if you're looking to either get into this industry or figure out your own journey. So please connect with me on LinkedIn, Victoria Reinhartz. Also, if you want the link to the Reinhartz Rundown, I'm sure we'll put that in the show notes for you on YouTube. Mobile Health Consultants is our website, and there'll be information there on education and the MIH Academy under the Education tab. So don't hesitate to reach out if that's something that you're looking for.
Awesome. We'll link to those in the show notes. And again, Victoria, thank you so much for taking time to come on the show. I appreciate it.
Oh, thanks so much for having me. I loved it.
As we conclude this week's podcast, an important reminder that the content on this show is provided to you for informational purposes only and is not intended to provide and should not be relied on for investment or any other advice. Information in the podcast and corresponding material should not be construed as a solicitation or offer to buy or sell any investment or related financial products. We urge listeners to consult with a financial advisor with respect to any investment. Furthermore, the information contained in our archived newsletters, blog posts, and podcasts is not updated and may not be accurate at the time you listen to it on the podcast. Opinions and analyses expressed herein are solely those of your financial pharmacist unless otherwise noted and constitute judgments as of the dates published. Such information may contain forward-looking statements which are not intended to be guarantees of future events. Actual results could differ materially from those anticipated in the forward-looking statements. For more information, please visit yourfinancialpharmacist.com/disclaimer. Thank you again for your support of the Your Financial Pharmacist podcast. Have a great rest of your week.